I'm Jason Hawk with the Chronicle Telegram and the Lorain County Community Guide. Today we've got David Covell, the Lorain County Health Commissioner, and he's interested in doing a Q&A, which is terrific because we've got lots of questions. So I hope that he's got lots of answers. There's a lot of uncertainty about what's going on right now as cases skyrocket. We're starting to see hospitals fill up a little bit, and that's got everybody on pins and needles, especially with some recent developments. So let's start there. Governor Mike DeWine has ordered a curfew for many types of businesses. It goes into effect today. I'm really curious, Dave, what do you think? Does a curfew make sense?
Yeah, so I think it's important to remember the governor's been struggling a little bit with, there's been discussion around bars and restaurants and things like that, but we're really not seeing it spread in the bars and restaurants. Our bars and restaurants have been doing a pretty good job. The concern is private parties. Right. And so the only time we see it spread in a restaurant is when 6 people from 6 different homes come to the restaurant and eat together for 2 hours, and then 4 or 5 of them develop it. Right. And so it's not really spreading in the restaurant. And so if you close bars or restaurants, don't they just go home and do the same thing at somebody's house? And so I think the curfew idea was really to get people to realize now's not the time to go out and socialize. It's go out, get what you need, come back home. And I think that's really what the intent was going to be.
Have you seen any kinds of problems, major problems with businesses that aren't complying with the rules that are already in place, that have been in place for a few months?
We occasionally find some folks that aren't following the rules. Most of the problem we've had has to do with businesses that are struggling with people who show up without a mask. And what are we supposed to do about that? Do I have to kick them out of my business kind of thing? And so that's been hard for businesses. And I think the governor's change on that, where it's kind of giving businesses the opportunity that they can hang a sign and say, sorry, you can't come in, is really an opportunity for those business owners to be able to control that a little bit. In general, our bars and restaurants have done a pretty good job. Our regular businesses have done a pretty good job.
The governor's been looking at these cases and warning us now for the past week that if things don't turn around, if the ship doesn't get righted, then restaurants, bars, fitness centers could all get shut down again. What do you think the governor's going to do today? And what do you think the governor should do today? Which might be 2 different questions.
Well, first, I think the governor has been wrestling with bars and restaurants. And I think the kind of fallback he's decided to do is this curfew idea and see if that can make an impact. And then I think, we'll see how the case count goes. And I think, later on down the road, he may have to try to make some other more stern, if you will, or difficult decisions. In terms of what do I think the governor should do, I think he's actually done a pretty good job of trying to balance the economy with how to slow the virus down. And it's really complicated. And as we learn more about the virus and we learn more about how it spreads, we know it is casual settings. And how do you control casual settings, people's behavior? And that's, I think, the part he's wrestling with.
Dave, my wife is the smartest person I know. And she looked at me the other day and she said, why don't we just shut everything down through the holidays, get it all out of our system, do a big purge. Students wouldn't miss that much school, to be honest. Let's just reset like we did in the spring, but maybe with a little bit less impact. Would that make sense to you at all?
Well, I think some of that could make some sense. I know some school districts are struggling because of staffing issues. They just, a lot, when you have this high of a case count, it's going to affect people in my staff, in your staff, and in the staff in schools. And so, again, there's going to be some of that. In terms of, shutting down bars and restaurants or shutting down other things where we don't know that it's spreading in those facilities, I'm not sure if that has an effect or not. Here's the psychological effect, I would say. When we had things shut down, people really were serious about, oh my goodness, we really got to stay home. Somehow we've got to get that message out so that people understand that it's personal behavior that's the problem, and we need to control that piece. And so I don't know that a full shutdown is really the way to go with that. More than just that would psychologically make people say, hey, I really got to take this seriously. So I think instead we need a really strong messages from our hospitals and from us and from the health departments and from businesses to say, get it together, people, please hang on. We've only got a few more months till the vaccine, and we can make it.
And you just said the magic word, vaccine. You and I have been talking about the prospects and timeline for a vaccine now for months. It seems like we're edging closer and closer every day. Has any new development come up in the past week that makes you really say, okay, now is the time to be optimistic about a vaccine?
Yeah, I am pretty optimistic about a vaccine, actually. I remember a few months ago, someone pressed me on this, and I came up with somewhere between December 1st and March 30th, we're going to have a vaccine. Now, of course, everyone thinks I'm just lucky, but
Well, it's a pretty good spread.
It's a pretty good spread, right? That's what they realize. So the answer is we're going to have at least 2 vaccines probably approved sometime in December. That's the Pfizer and Moderna. Those are 2 doses. There are also some cold chain issues around those. So those would be really good for medical workers. So hospitals, other folks like that can vaccinate their own staff, so those frontline workers that are working so hard right now, they can be protected. Then we'll also look at long-term care facilities and some other places like that. There's a couple of other vaccines that are also coming that may be a single dose and easier to maintain, in terms of cold. And those might be better for mass vaccination. But either way, the first vaccines will be here in December and January for the frontline workers and the high-risk people. And then I think in March-ish, March or April, we'll have enough to start vaccinating the bulk population.
I want to backtrack and just clarify something that you said. You mentioned that 2 vaccines, the Pfizer and Moderna vaccine, are likely to be approved in December. Does that mean that they're going to be available in December?
Yeah, so for those of you who don't know, they pre-made, most of the vaccines have been pre-made in anticipation of them getting approved. So they pre-made about 10 million each. I think Moderna said they may even have 20 million ready to go if they get approved. And if they do get approved, then they'll have 20 million immediately. That's not a lot for the whole country. So it's probably more like 60,000 or so in Ohio. So, I mean, you're not really talking about a huge number. But my suggestion is, it will be good to really start that process in terms of the healthcare people. And that'll happen early. That'll happen in December, January. The question is, Pfizer mentioned they can have 1 billion doses by April. So again, you start looking at those numbers, by April, we could really have enough vaccine to really start vaccinating folks.
Yeah. Let's pivot right now and talk a little bit about what you're seeing in Lorain County. Are there certain trends that you're really keying into? Because as we've talked about, there's not just the case count, there's lots of indicators. But what are you seeing that is alarming you, and what are you seeing that is reassuring you?
So there's 2 big pieces. And I've said this early on, I've tried to be the calming voice to say, hey, listen, this is what's going on, and try to calmly talk about that. And I said my voice would change a little if the hospitals got in trouble. Well, we're right on the edge of that right now. And my voice is changing a little. And I'm saying, get serious, because again, as hospital beds fill up, it's not just about treating COVID patients. The problem is if you get in a car accident, you have your child is in a bicycle and flips over, and or you have a heart condition or something like that. There may not be a bed for you if they're all taken up by COVID patients. So again, the idea to slow the virus down isn't because you personally may not end up with a bad situation with COVID. It's because you could give it to a healthcare worker, and we're hurting there. We want them to have enough people to treat people. And then secondly, if the beds get taken up, you won't have beds for other situations. So that's an alarming trend. I think you've heard that from the health commissioners, but you've also heard that from the presidents of the hospitals, that we've got to get it together and stay vigilant for the next few more months.
Speaking of the next few months, we have Thanksgiving here coming up very quickly, and then it's on to all manner of other holidays before the new year. Are family gatherings really that big of a deal? You've talked about limiting family gatherings, rethinking family gatherings. They're not a big deal, right? We know our families. We can trust our families. We're all safe.
Yeah, everyone kind of assumes that if I'm genetically related to my brother or my sister, they must be in my bubble. They're not in your bubble unless they live in your house. And so the more families you bring together, the more spread of that risk that you have. So we've really given some guidance. The safest thing is to do Thanksgiving and Christmas just with your immediate family in your house, and then maybe Zoom or do some other things. Spend a little extra time with board games and football games or whatever you want to do. If you do say, well, my brother lives, around the corner from me, and I want to just have his family and my family. Well, okay, well then limit it. Separate the tables. Wear a mask when you're inside together. Limit the time that you're together. We've got some good guidance out there to kind of say, hey, we could still show our affection for each other. But really, the key is this. I have an 89-year-old mother. I'm not going to have her over for Thanksgiving for the first time as long as I can remember. But again, I want her around for next year's Thanksgiving. And my worry is if I bring her over for this year, I may not have her for next year. So again, hang in there. But this is the year to sacrifice a little around the holidays.
The Chronicle's been reporting recoveries every day since the health department started releasing them, which is good. It's good to see that balancing out the new case numbers. Should we read anything into the fact that recoveries weren't posted starting Tuesday?
Yeah, so let me apologize a little bit for that. We are at such a high case count. We had 944 cases last week. We were up over 150 cases a day for a while. So we're struggling with some of those pieces to get those data updates. We can put the case number up and we can do some of those things, but some of that data is going to lag a little now. It's all hands on deck to handle the cases we have. So I apologize. We're not trying to hide anything. It's going to take a few more days to get that information up.
Just relieved to hear it's not a red flag, honestly. And in some ways, I suppose it is a red flag, but obviously you're not trying to hide anything. But
right.
To continue talking about recoveries, help me understand this. What qualifies someone as being recovered in the eyes of Lorain County Public Health?
So if it's been at least 10 days from when you started symptoms and you have 24 hours of no symptoms, you're recovered. Okay, that means you can't shed the virus anymore and you're recovered. Now I know some people have said, I know the state calls it something else because they don't want to necessarily call it recovered. It's when you can go back to work. Right? That's the criteria to go back to work. We consider you recovered at that point.
A step in the other direction. Unfortunately, we have seen a number of deaths in Lorain County. I think my last knowledge was about 90 deaths. One of the frequent things that we get is criticism that deaths are caused by other things and attributed to COVID. Have all of the deaths in Lorain County been people who had other issues, and what would that mean?
Yeah, so we actually looked at that because we were concerned because we had heard that. And we found a couple of irregularities. They're not actually in our number, but they were ones that we were going to put in our number. But then we found out that no, they actually had COVID a while before and they weren't actually attributed to their death. So there is occasionally, because again, think about this. If you die of pneumonia, right, and you had COVID, well, that makes sense. It's a COVID-based pneumonia. But if you die of a heart attack and you had COVID 6 months ago, well, that's probably not the cause of death. And so you do occasionally have some of those. And we had maybe throughout this whole time, we've maybe had a handful of them. But really, this is not a significant thing. I know it's on the internet, but that doesn't make it true. Again, occasionally we'll find one of those, but not very often.
Dave, parents are worried about their kids. I know that I am. So when there is a case at school, who do you consider to be a close contact that needs to quarantine?
So the one thing about how the schools designed it is they really had kids wearing masks and staying separated. And so they really did a nice job of not having to have to quarantine too many people. So an example might be 2 kids who sit next to each other on the bus. Okay, even if they have a mask on, they're going to get quarantined. That other person's going to get quarantined. Maybe they eat lunch together and they don't have a mask on. If they can't spread kids out enough and they're only a few feet away from each other when they're eating lunch, they're probably going to get quarantined. We've had a few of those. And then the other one is a scenario like after school. So maybe you have a child who hangs out with another child after school, right? And so even though in the school they didn't get quarantined, they might get quarantined anyway because they go and play with that kid. And so therefore there can be a close contact. We really haven't had a lot in the classrooms. There are some specialty classrooms that we've had a couple issues where, they're right next to each other. Or we've had some with tutoring where the tutor has to sit right next to the child and one of them came back positive and the other one gets quarantined. So a few of those do happen, but really for the most part, it hasn't spread very much inside the classroom.
Along the same lines, does contact tracing start when a student or staffer tests positive with a rapid test? This is something that I'm hearing more. Are parents notified when someone tests positive with a rapid test?
Yeah, I can't, please, if nothing else comes out of this, let's make sure we're clear. Do not get an antigen test. Rapid antigen tests are not that accurate. And the problem is they're not a confirmed case. So if you come back positive with an antigen rapid test, go get a PCR test so that you know for sure if you had it or not. If you get an antigen test, we will not necessarily be contacting you. Early on, when we didn't get that, when we weren't flooded with real confirmed cases, we'd investigate these a little to find out, are you really positive or not? But antigen tests just aren't that accurate. And one of the problems is, like you saw with the governor, remember he got that antigen test, then he went back and found out that it was a false positive. We've been seeing a lot of that. We don't even investigate those unless we have the time to do it. And when you have 944 confirmed cases in a week, you don't have time to do these others. So the answer is, you may, if you got an antigen test and it's positive, go back. You should be getting advice from the testing agency, but in case you didn't, go back and get a PCR test.
I think the number I've seen, it might have even come from yourself, is that the antigen tests are only about 40% accurate. Is that right?
Well, early on that was the case. There was actually one that was really bad, and that one's gone. So these are they're more accurate, but they're really an indicator. That's really what they're supposed to be used for. And if you get a positive, then they say, hey, go back and get a PCR test. But unfortunately, no one's getting that message, and they're waiting for us to call them. And frankly, we're not going to call you unless you get a PCR test, a confirmed case.
I've heard some parents voice concerns about students returning to school after they had been quarantined for only just a few days, 6-7 days. Is that happening, first of all? And if so, why?
Yeah, so that would be if the child didn't actually have COVID. So what's happening is you have COVID symptoms, the nurse sends you home, right? And it turns out it's not COVID. It turns out it's something else. Then they can come back as soon as the symptoms are gone. If it turns out they're COVID positive, then they have to stay out the full 10 days and 24 hours with no symptoms.
Masks have been a big deal, of course. Neither of us are wearing them right now. We're not anywhere close to each other in different buildings. But who doesn't have to wear a mask? Police officers, people who work outside, sports teams?
Yeah, so there's some exemptions where obviously you wouldn't wear a mask. Obviously, if you're running in the park, you're not going to be wearing a mask, most likely. Some people do, but that's a scenario where you're not near someone. If you're in a scenario, but police officers actually, they technically can be exempted in certain areas because, again, if they're in an arrest scenario where they're chasing someone or some of them are not wearing them in those cases. We are recommending to those police officers whenever they're in a meeting, whenever they're in a scenario like that they're wearing a mask. And even when they walk up to a car, it's a good idea to be wearing a mask. Same with firefighters. Again, they're wearing that PPE when they go and deal with folks. But when they're back at the firehouse, that's again when we want them to keep separate and wear a mask and do that kind of thing. In terms of who doesn't, who has like a medical exemption, there are some folks who have asthma and some other things where they struggle a little bit wearing a mask. And again, for those folks, that's where you try to stay out of public settings, right? That way, because again, if you have that same breathing condition, you don't want to get COVID either. So again, if they could stay separate, have food delivered to them, do the drive-throughs, that kind of thing, it really helps a lot.
There are certainly a lot of people who aren't wearing masks in situations where it's my understanding they should, in stores, in public meetings, in the drive-through, taking them off to speak to each other, or they're just not wearing them properly over their noses and mouths. What do you say to those people?
Well, you've heard it before, right? Masks do work, actually. If I'm wearing a mask and you're wearing a mask, we're 6 feet apart. Now we have 3 barriers between us. It really does work pretty well. So here's what I would say. Try to wear it properly, right? Let's make sure we're putting it up over our nose, right? It's all the way on, right? Not down like this, okay? And so that's one piece. The other thing is, business owners have been frustrated because they ask people to wear a mask, and sometimes that turns into an argument. I still don't understand this. We've talked for many years about the greatest generation and how World War II people have really done incredible things for our community. I still think it's worthwhile to wear a mask, wash your hands, and stay separated so that those World War II veterans that are still around don't die of COVID. And frankly, I think that's a reasonable thing to ask. It's an inconvenience. I understand. I don't love wearing a mask, but again, it's not that hard to do it, and we can slow the spread. And it may not affect me or you. You and I may be fine if we get COVID. We may have a rough little time, but we'll survive it. But what about those folks that were around and helped defend this country in the greatest generation, as they call it? How about if we help with them? And so there is some frustration there on my part that people are so upset about wearing a mask that they're not willing to help their neighbor.
What do you think is an appropriate response for me as an average guy out in public and I see someone who's not wearing a mask? Do I walk away and forget it, wash my hands of it? Do I talk to them? Do I call the police? Do I call public health? What do I do?
So a couple things. First, it's not worth getting in a fight over. If someone asks you, why do you wear your mask? And they say things, and I've had people say, well, I'm not scared. And I tell them, it's not for me, it's for my neighbor. I really care about my neighbor, and that's why I wear a mask. And I leave it at that, and I don't bother getting in an argument with them. My suggestion is, if you see something like that, again, it's not worth the argument. But again, if they want to talk to you about it, that's a good thing to say. It's about your neighbor. It's about helping each other. In terms of if you see a business where there's a lot of people without a mask, there's that new mask order for businesses now. There is a 1-800 number I can give you that you're supposed to call if you do have a problem with a business that's not requiring masks. That 1-800 number is 1-800-427-5634. And that's the ODH hotline. And then they'll have the Bureau of Workers' Comp actually who's doing the enforcement on that. Again, most of our businesses are doing a pretty good job.
Lorain County Health Commissioner David Covell, thank you very much. You're always great. You always answer the phone, and I appreciate that. Thanks again.
All right. Great seeing you.